Hello, my name is Nadine Ranger and I'm a pelvic health physiotherapist from University Hospital Sussex NHS Foundation Trust. If you're watching this video, you've probably recently undergone or about to undergo major gynae surgery at the Trust. This video has been put together to give you some information about post-op recovery. There is another video that you can access that gives you information about the types of surgery that you may be having. So immediately post-op, it is important to do a couple of exercises. One of them is deep breathing, and the second is foot and ankle exercises. So deep breathing exercises are important after an anaesthetic, just to make sure that you're reinflating your lungs and making sure that if there is any phlegm or sputum on your chest, that you can clear that. So the way you would do a deep breathing exercise is relaxing your shoulders, hands on your tummy, taking a nice deep breath in through the nose. And as you take a nice deep breath in, allowing the tummy to rise like a balloon. And as you breathe out, allow the tummy to relax. So you're taking a deep breath in, allow the lower ribs to expand. And as you breathe out, allowing them to relax. If you needed to cough or clear your chest, if you have a tummy wound, you may put a folded towel or a cushion on your tummy just to give it a little bit of support. And rather than a cough, you may do a huff, which is a short, sharp breath. So as if you're steaming up a mirror or a pair of glasses. So a forced expiration, holding onto the tummy, may give you a little bit more comfort than a cough. And in terms of the deep breathing exercises, you would do 3 or 4 at a go, and maybe try and repeat every hour or so until you feel that you're fully inflated and feel that you have no problems with your chest. The next exercise that's important to do is foot and ankle exercises. So you may have some stockings on your lower legs, and they will obviously give you some compression, but it's important to make sure that you're moving your feet as well. So up and down, as the arrows suggest here, up and down movement, down towards the floor and up towards yourself. So pumping the feet up and down, a good 10 or 20 pumps at a time. You can do circles if you want to, but it's more the up and down movement that will really boost your circulation. In terms of getting out of bed, it's important to roll on your side to get yourself out of bed, and that will make sure that you're in a favourable position for your back and your pelvis. The other exercise that you can do in a post-op period is just gentle knee bends. So with your legs out in front of you, just sliding one leg up and the other leg and repeating a few times, just to make sure that you're mobilizing gently in the bed. And then once you're up, you can gradually increase your walking. So just walk as pain and comfort allows. So let's look at recovery in the first 6 weeks. So it's important to continue to roll out onto your side to get out of bed, as I said, which is favourable for your back and your pelvis. And it's important to avoid heavy lifting. So you may start with something as simple as 1 or 2 kilos. So a kettle or a mug or a glass, and see how that feels. And then gradually increase it as comfort allows. You, in the first 6 weeks, need to avoid heavy housework, so vacuuming and other household activities, and avoid standing for long periods of time. So you may start just with 5 or 10 minutes and see how that feels, and gradually increase the amount of time that you're on your feet, and gently build up your walking. So for every week after surgery, you potentially may increase it by another 5 minutes. So it could be the first weeks 1 and 2 that you're just walking 5 and 10 minutes at a time and then resting. Another 5 or 10 minutes and then resting, and then gradually increase that as you're able to. So for example, by week 6, you may be walking up to 30 minutes at a time if that feels comfortable. And you can repeat the 30 minutes, but at one time, 30 minutes by 6 weeks is probably enough. But it's important to listen to your body. So everyone's different, and the people that may have had this surgery will vary hugely in age and capacity. So it's important just to make sure that you're listening to your body and you're gradually increasing as your body allows you to. So pelvic floor muscle training, very important after gynae surgery. I'm not going to go into too much about the pelvic floor today. There is, at the end of the presentation, there is a link to pelvic floor exercises, which is a YouTube video that a couple of the team have put together to give you more information about pelvic floor. But essentially, it is important to make sure that you're starting your pelvic floor exercises not until you've had a catheter out. So wait until the catheter is out and you're passing urine as normal. And generally after gynae surgery, the first couple of weeks after surgery, we would ask you to just start very gently and see how it feels. And if you're having any pain or discomfort, then leave the pelvic floor and add them in at a later stage. So let's look at the deeper tummy muscles. So another exercise that's really important is just to be able to use your deeper tummy muscles, so your core muscles. So if we look at this diagram here, the lower part of the tummy, the deeper tummy muscles are here, and then your pelvic floor sits like a sling or a hammock underneath you. And these muscles work together to give your body support. So it's really important that you're switching on your lower tummy muscles. So the way that you might do that is relaxing your shoulders, placing your hands gently on the tummy, and it could be that you're in a sitting position or a lying position, or lying on your back or lying on your side. Place a hand on your tummy, take a nice deep breath in through the nose, let the tummy rise like a balloon so the lower ribs are expanding. And as you breathe out and the tummy relaxes, just seeing if you can gently pull in that lower tummy. So pulling your lower tummy towards your spine, and pull that in for a few seconds, release and repeat that, and see how that feels, and gradually increase the amount of times that you're doing. So let's talk a little bit about bladder and bowel care for the first 6 weeks. So it's really important to sit on a toilet as opposed to hovering, which helps you empty your bladder better. Make sure you have enough fluid so that you're drinking plenty of water. Avoid too much tea and coffee if you can, but water at room temperature is the best way to keep us hydrated. It's important to avoid constipation. So eating and drinking the things that help you go to the toilet is very helpful. And you may be given a laxative to take after surgery. And we would suggest that you do take the laxative, and to ensure that you're not constipated and you're not straining. So straining after gynae surgery, especially with vaginal surgery, can cause a little bit of downward pressure, and therefore may interfere with the healing process. So this little lady on the toilet here, in terms of other ways to help her, popping her feet up on a step stool may be helpful. So a small step stool, so about 15 centimeters is generally adequate. Leaning forward, which helps to change the angle in the bowel. And you may want to use muscles lower down in the tummy. So underneath your rib cage, if you feel underneath your rib cage, under your lower ribs, imagine that you're going to make a p sound. You never say the p, but you hold the in your mouth. And by doing that and creating that pressure, you should be widening at the waist. And those muscles will be very helpful to help you go to the toilet. So you're not straining down below, you're relaxing your lower tummy, relaxing your pelvic floor, but using muscles higher up into your pelvis to help you go to the toilet. So if you need any support down below, so if you've had vaginal surgery, you may want to get some folded tissue and just support underneath, just to give you a bit of comfort. And if you have a tummy operation, tummy incision, you may want to again have a folded towel or a cushion on your tummy, just to give it a little bit of support. So let's talk about recovery in the 6 to 12 weeks after your surgery. So it's important just to continue progressing your walking as feels comfortable. And if you're doing any other exercise, really only low impact exercise should be done. And certainly not to start that until any vaginal bleeding or discharge has stopped. And good choices would include swimming, cross training, and sort of early Pilates exercises. And if you see an instructor, then it's important to make sure that you inform them about your recent operation so that they can adapt anything accordingly. And if you have a sedentary job, a job that involves mainly sitting, you may feel that you can return to that to 6 to 8 weeks after your operation. So more long term. So in terms of increasing your exercise, it's important to do so, but really listen to your body. So if something feels wrong, it probably is. So make sure that you're gradually increasing the amount of exercise that you do. but listening to your body at the same time. And remember, high impact activity can increase the risk of prolapse operations. So it's important just to think about things like running, jumping should be avoided if possible. It's important to keep your weight in healthy limits. So thinking about, as well as exercise, thinking about good food choices, and making sure that you're not overeating in the post-op recovery period. So continue to avoid constipation. That should be long term. So straining to go to the toilet can cause problems around the vaginal area. So it's important to not be constipated. If you have a cough, try and get it sorted. So if you have asthma, for example, try and make sure that is well medicated or well managed. And any other chest conditions, making sure that you are speaking to your doctor and making sure that you manage those conditions. So limit lifting when you can. So sometimes you'll have to go back to doing various activities and various lifting. But in an ideal world, if you can break down a job into smaller jobs so that you're not doing something that's too arduous, then that is really important. And using a good technique. So if you are lifting, making sure that you are moving the object closer towards you, and you are making sure that you are, when you're lifting, that you are squeezing your pelvic floor, tightening your buttocks and your lower legs. And if you have a physical job, then you may be thinking about going back around 10 to 12 weeks. And generally a phased return is recommended. So not going back all in one go, but gradually increasing the time that you go back to work and seeing how that feels. So useful information. So these are 2 leaflets that are produced by our society, POGP, which stands for Pelvic Obstetric and Gynae Physio. So a leaflet on pelvic floor that can be downloaded, and also Fit Following Surgery, which is the booklet that you may be given. And if not, you can download it from their website. And this is the link to the pelvic floor exercise video, the YouTube video, that you will need to copy down and so you can access. Thank you very much for listening. I hope you've enjoyed listening to this video. Thank you for your time. Bye.